This is Howard Gilbert. I'm in the apartment of Miss Audrey D. R-E-Y-N Bell at 4317 Hartford, apartment 103 in Dallas. Today is March 12th, 1977, a Saturday. It is approximately 6:35 in the evening. Also present is Mr. Jack Moriarty of the task force, and Miss Bell's sister is also present in the room. I'm now going to check and see that it is recording properly. Now, Miss Bell, you can observe that we are tape recording a statement from you, can you not?
Yes.
And this is done with your permission, is that
Yes.
correct? Now, prior to our taping this statement, we chatted for some 15 to 20 minutes, is that correct?
Yes.
All right. Now, Miss Bell, I want to direct your attention to November 22nd of 1963 and ask you where you were employed at that time.
Parkland Memorial Hospital, Dallas.
All right. And in what capacity were you employed?
Supervisor of the operating rooms and recovery rooms.
All right. Now, do you recall the incident where Governor Conley was operated on that day?
Yes.
And do you recall who the orthopedic surgeon was?
Yes, Dr. Charles Gregory.
And who was the thoracic surgeon?
Dr. Robert Shaw.
Now, you have informed me that certain foreign bodies were taken from the body of Governor Conley, is that correct?
Yes.
And what is the procedure that was used at the hospital for the removal and recovery of foreign objects?
On that, the procedure is that the objects are removed by the surgeon and either placed in a container or given to the scrub nurse to place in a container on the scrub nurse's table. Then they're taken...
Well, just a minute. Would you describe the type of container that they would be placed in?
A small glass container, about a 1-ounce medicine glass.
Similar to a size and shape to a shot glass?
That's right.
All right. After the objects are placed into the container by either the doctor or the scrub nurse, what then occurs?
On that particular case, they were given to me, and I took them into my office and prepared one of our foreign body envelopes.
Foreign body envelopes? What
Yes.
is that? Would you explain that?
We had a foreign body envelope in which we could record the name of the patient, the hospital identification number, the foreign body, with a description, whether there were any markings on it, who the surgeon was, and we signed it off ourselves.
Would you describe on the envelope the number of objects placed within the envelope?
Yes.
And with respect to the objects taken from Governor Conley's body, who prepared that particular envelope?
I did.
That was done in your own hand?
Yes.
And did you place the objects that you took from the operating room in the envelope yourself?
Yes.
Did you seal it yourself?
Yes.
And did you place the description of those objects on the envelope?
Yes.
Now, to the best of your present recollection, how many individual foreign objects were placed into that envelope taken from Governor Conley's body?
4 or 5. I am not sure at this particular time.
Do you have a recollection as to whether or not those objects were metallic objects?
Yes. They were metallic, grayish in color, as well as I recall.
All right. And after you placed them into the foreign body envelope and sealed that envelope, what did you do with it?
I delivered them to the FBI, and he signed a form. This was a deviation from our procedure. He signed, I took an inter-office memorandum and wrote on there about my delivering these to the FBI. I believe Mr. Sorrells, and he signed it.
Now, you believe it was Mr. Sorrells?
I believe so. I recall this name. I
You
recall this name.
recall the name, but you're not
I'm not
positive
sure.
at this point that
No.
it was Sorrells.
No.
But it was someone from the FBI
The
who showed you
FBI or the
identification.
Secret Service that I gave it to.
Did
And I
they
think
show
it
you-
was the FBI.
Did they show you identification?
They probably did. I saw so much ID that day that because we had so many of these people around in surgery.
When the envelope was turned over, it wasn't a sealed condition, is that correct?
It was sealed.
And if the envelope was to be produced today and the envelope described the number of metallic objects, that would have been the number that you yourself ascertained went into the envelope at the time that you sealed it?
Yes.
And you're sure of that?
Well, that's what I put in it. I don't know what would have happened to it since then.
Fine. Now, your best recollection, you indicated to me, was how many specific types of foreign objects or number?
4 or 5.
All right. Now, I have asked you to, on a piece of paper with a pencil, to draw for me, if you would, the smallest in size, on a one surface size, of the foreign objects. Would you do that again, please?
It's difficult.
All right. Now, would you please put a large circle around that? And would you write your name next to that, please? And would you place today's date, which is March 12th? Now, you have written that in pencil, have you not?
That's right.
Now, will you please circle the entire thing that you have done with a blue felt tip pen? And would you write on there Exhibit A? Now, Mr. Moriarty, I'm going to ask that you also sign that sheet of paper at this point. Now, if I understand you correctly, you're saying that of the objects, the foreign bodies that you placed into the envelope, the small pencil diagram that you have just drawn indicates the smallest, in your recollection, of the foreign objects that would have gone in.
Yes.
Would you fill in the blue ink the little circle describing the object that you have drawn in pencil? In other words, just kind of color it in blue so that we have it as a permanent record. All right. Thank you. Now, we may have said this, we indicated that we were taking this statement at your residence, which was 4317 Hartford. Your home phone is 526-5369?
Yes.
And your present office address is, telephone number is 637-3820, extension 317?
Yes.
And you are presently employed by who?
Children's Medical Center.
And you are the what?
Supervisor of the operating suite.
All right. Now, is there anything that you would like to add with respect to what we have discussed here to make your statement more complete or to explain anything that we have discussed while the tape recorder has been on?
Just that it has been many years, and this is all just trying to recollect what happened on that date. I cannot swear, I cannot be absolutely certain of the number of small fragments.
Your best recollection is?
But my recollection is 4 to 5.
All right. Mr. Moriarty, do you have something to add?
No, I haven't.
Then it is now 6:45 p.m., and this is the termination of the tape.